Not the ending Broder was looking for, but he says an inevitable one for a practice of his size now that we have the Affordable Care Act.
Now it's to the point where you've got to see 50, 60 patients a day to make things work.
Besides increased wait times, Broder says now instead of simple tasks he could have handled in a day, like referring someone to a specialist, now he has to go through an approval process for medicine and scans, which could take weeks or even months. It has doctors like him flocking to bigger groups like hospitals that have more people and more power to negotiate with insurance companies.
Those who support the Affordable Health Care Act will be the first to trumpet people signing up. Better health care for all involved in what they claim is nothing more than a complete rebuke of what the critics were saying about the president's plan. Saying all of this is easy. Backing it up with facts and honest tales from the ground level is something they would rather is avoided. Because when you get to the doctors themselves, it seems to be a very different story. Let's welcome to MdiPoint. He's practiced family medicine for over 30 years, small towns, cities, emergency rooms, clinics, everything in between. You'll also read his comments at thesurvivaldoctor.com. It's a pleasure to welcome Dr. James Hubbard, and also Director of Internal Medicine at Doctors for America in Fredericksburg, Virginia, Dr. Chris Lillis. Doctors, thank you so much for being here today.
Thank you.
Let's go ahead and set this up with some numbers. First of all, the Physicians Foundation releasing a survey, and it was not good for the Affordable Care Act. It showed that 46% of physicians give the Affordable Care Act a D or an F, while 25% give it an A or a B. Only 3.7% of those doctors that were questioned actually gave it an A. Dr. Hubbard, I'm going to start with you. What's your grade?
I'd say about a D. I'm surprised that the percentage was that high on an A.
Now, why do you give it a D?
Well, it's just one more of the multiple interferences between the doctor and the patient and gets in the way of our treatments. I know that we need some guidance and there are things that need to be changed, but all we're doing now is setting up a more of a bureaucracy, more of people in the middle that are going to frustrate doctors even more and more, and doctors are just going to decide, well, it's not worth it.
All right, Dr. Lillis, your grade.
My grade's a B+, and to the other speaker's point, I think the bureaucracy that remains between me and my patient in the case of individuals who purchase individual health insurance on the exchanges is the for-profit health insurance company. And yes, these companies, despite getting millions of new subscribers, millions of new customers, are engaging in a lot of underhanded tactics to try to continue to control costs. Things like raising the price of generic medicines, restricting networks, forcing prior authorizations on physicians. And I understand Dr. Hubbard's concern, but I think he ought to train his blame on the insurance industry, not on Obamacare.
Dr. Hubbard, go for it. The insurance industry, and I will tell you that there's a lot of people I speak with in the medical community who will say that. The doctors aren't happy, but they say the insurance companies are making it just impossible to deal with.
Well, sure, the insurance companies have a lot of blame, but I've also dealt with Medicaid and Medicare over the years, and I know that if anything, those are worse. At least the insurance companies have some incentive to please people and to help. And sure, there are a lot of good people in there on both sides. But I've had Medicaid. I've personally called for and waited for 30 minutes on the line with Medicaid, only to finally get a little thing at the end saying, sorry, but we're closed now. Please call back tomorrow.
All right, now hang on. I want to stop you there for a sec because I want to go to Dr. Lillis on this. Dr. Hubbard makes a very good point. Every single doctor that I have talked to personally tells me that exact thing. Since the Affordable Health Care Act, they are stuck in a quagmire here right now, and they can't get their job done because what they're telling me is 70% of their time is spent actually doing paperwork, calling, follow-ups, dealing with the insurance companies, and they're only getting 30% of the time for their patients. Now, wouldn't you agree that that's a huge problem?
Sure, but if you wanted that to be changed, you'd probably look for a solution like Medicare for all. Medicare does not require prior authorizations or referrals, and that's where I get most of my time wasted. And yes, Medicaid certainly has those processes. All 50 states administer Medicaid differently, and they are trying to ratchet down costs, and they do so by essentially creating narrow networks, restricted medication lists, and make it difficult for us to simply give the medicine that we want. But insurance companies that are for profit, that are really more beholden to their shareholders than their customers, are the ones that are putting most of these burdens on physicians. And I would say that Medicare is the easiest insurance company that I deal with in my daily practice.
Dr. Hubbard, your response.
Yeah, I think you have a point there, and I think that's part of this problem. Is that I think that I don't know if it's a plan or not, but I think that things are getting more complicated, and to the point where one of these days everybody's going to say, hey, the easiest thing to do is go to single payer, and then the government's going to run everything and be able to tell us what to do for everything. People say that Medicare, what about Medicare? It's been going along. Well, it's had problems for a long time too, and I think that one of the reasons that private insurances and private pays have gone up is because Medicare pays less, and a lot of family practice people that are in solo practice or whatever, it's really hard to eke out a living. I'm not talking about getting rich. I'm talking about eking out a living if you only saw Medicare patients.
Dr. Hubbard, are we driving then physicians who have their own practices? Are we taking them and pushing them into these large groups? Again, I'll tell you from personal experience, I know a lot of doctors who've had their own practice. They say, I can't do this anymore. I have to wind up going to work for somebody, and that then is taking me away from my patients. And these companies I then go to work for will tell me, get them in, get them out, get them in, get them out. Don't spend any time in here, don't work with them. Isn't that part of the issue here as well?
Yes, if we're getting paid less, number one, we're going to have to see more patients just to make ends meet. And of course, I think that there's no doubt that private doctors are going into bigger and bigger practices to save money, to be more efficient and things like that. May or may not work, but there's another bureaucracy we're going to have to deal with. And in small towns and in places where the people are really needed, sometimes that's not possible.
Dr. Lillis, would you agree with that we're driving a lot of the independent doctors, and I just use that phrase, independent doctors, we're just driving them out of business now thanks to Obamacare?
No, it's certainly not thanks to Obamacare. I think there are a number of pressures on small practices, pressures including declining reimbursements from all payers, pressures like the need for electronic medical record systems, which is not mandated in Obamacare, but certainly improves patient care and efficiency. I'll tell you, one of the sectors of our healthcare economy that I'm most frustrated with are the IT vendors who charge higher and higher prices with less and less support.
Okay, explain that. What do you mean by IT vendors so the public understands?
Sure. So my small practice, I have 3 partners. We're an independent practice in Fredericksburg, Virginia. We were forward thinking. We adopted our electronic medical record system in 2002, long before there were ever incentives to use electronic medical record systems. And what we found is that first iteration, there was a lot of competition among vendors and some decent customer service. Well, the products, what we're finding is that these companies are scrambling to get the influx of physicians who are converting to electronic medical records, and they are not providing the customer service that they used to. And in fact, are finding new ways, inventive ways every day to bilk the physicians out of money. So I think the pressure to end up in a large practice mostly is because it's the economies of scale that anyone would understand, that the more physicians you have in a group, the less expensive per physician it's going to be to maintain the basic infrastructure of a practice that is very costly.
I got about 90 seconds left here. Dr. Hubbard, let me get to you on this one quickly. 39% of the doctors surveyed said they're planning to fast-track retirement plans because of changes in the healthcare system. Isn't this something that also is a problem that is not getting enough attention, that quite frankly we're going to be at a dearth of doctors, if not soon, but very soon when it comes to treating a lot of people who are now pouring into offices?
And again, we're talking about primary care, which is one of the shortages anyway. And yes, it's a big problem. And I don't see this going to get any better. And also, what about the people that are going into medicine? It used to be the best and brightest, and I'm sure it is now. But there's so many other options that if we go in to help people to make good money, prestige, but mostly to help people. And if you're taking all your time for bureaucracy and things, then you might consider another field where it's a little easier.
Let me ask you this, Dr. Lillis. Would you agree with the headline in the Washington Examiner, though, that says get government out of health care?
No, I would not agree, because
Really?
actually Medicare and Medicaid do a better job of cost controls than private insurance do. And my understanding of your positions generally is that you want to see fiscal conservatism infused throughout any plans that happen in the United States. We need to make sure that we're using medicine efficiently. We need to use evidence-based practice. And I find that the government's going to do a better job of that than private insurers who are beholden to their shareholders.
We just want to make sure that everybody gets the doctors they need and make sure that everybody gets their care, no matter what side they're on, left, right, or in between as well. Dr. James, there you go. Dr. James Hubbard, I'm sure you'll agree with that as well. Dr. James Hubbard, Dr. Chris Lillis, thank you so much, gentlemen, for a very honest conversation. We'll do it again.
Thank you.
All right, later on this hour, Round the Dial with Grant Stitchfield from deep in the heart of Texas. And after the break, the Money Master, Alibaba, and a whole lot more right here on MidPoint.